So you're newly diagnosed with type 2 diabetes and you just want some information. You want to know how to go about this. You want some support. You're not alone. My name is Patrice, the Patrice.Denise. I'm over here living a healthy, sustainable life, one day at a time, one step at a time. And November is National Diabetes Awareness Month, and I wanted to give some information, give some encouragement, help someone else along the way with understanding and managing type 2 diabetes. I myself in the past was diagnosed with type 2 diabetes. Real quick, I was diagnosed with gestational diabetes during my second pregnancy, and from there, I continued to have the diabetic symptoms. And at one point, my A1C was as high as 13%. A1C is the blood test that is used to find out what your average blood sugars are for the past 3 months. So it's not a snapshot at one particular time or at that time that you get that blood drawn, but it's an average. It looks at your blood sugar levels over the past 3 months to get an average, and it's a percentage. And so 5.7% and below is a normal range. Anything between 5.7 and 6.4 is in the pre-diabetic range, and you may have been diagnosed with a A1C at 6.5 or higher. So normally your doctor would do a in-house test. They may have asked you to fast. They may have you may have came in for your visit. You did a finger stick in the office, and that was over 125-ish in the office, where they tested your blood sugar to see what it was at that particular time. And that could have been above 120, 125. And so they may have sent you out, or they had a machine in-house where they did the A1C in-house and they checked to see what your average blood sugars were over the past 3 months. And that's how they came up with the diagnosis of type 2 diabetes for yourself. So you're not alone in this diagnosis. I too was diagnosed with type 2 diabetes, but we can work and get our A1C down. We can learn about diabetes. We can learn what we should do for ourselves, for our body, in order to bring our A1C down, to bring our blood sugar levels down, and in order to live a healthy, sustainable life. Let's just get into some tips that can help you as you're learning to manage this diagnosis and as you continue to live life in general. So, number one, I want you to know that you may have different feelings right now. Yes, you may have feelings of disbelief. You may have feelings of anger. You may have feelings of being sad. You may have feelings that this cannot be me. Or you could be blaming yourself for what you've done in the past in order to be diagnosed with diabetes. Those are all normal feelings. Work through those feelings. I would say if you need to, if you feel these feelings are overbearing or overtaking, definitely reach out to someone who is professional, a professional therapist, counselor, dietitian, a diabetes educator, someone like that to help you with navigating those feelings. But yes, those feelings are valid. And as you continue to learn more about this diagnosis, they will continue to ease over time, hopefully. I too had the feeling of doubt. This is not me. No, I'm not. My blood sugars are okay, even though they were plainly written in black and white that they were not okay. So I can definitely understand your feelings right now. But just know that continue to work through them. They're valid feelings. Recognize those feelings. And if you, like I said, if you need to get professional help with managing those feelings, definitely do that. But what should you do first when you first learn that you have type 2 diabetes? Well, one, if you are able to research about diabetes. What is diabetes? How can I manage this on my own, as well as with my healthcare provider, as well as with other professionals? How can I manage it? So look up self-management tips on diabetes. I'll give you a few here in a second, but just, get some information for yourself. Research, become your own advocate so that you can, when you go back to the doctor or you go back to your dietitian, when you go back to that diabetes educator, you can present different questions and different things to them that can help you along the way. Learn about the medications, and we'll talk about that in a second. Learn about the medications that they put you on, and also learn about diet and nutrition. Okay? So, managing your blood sugars. Well, definitely, I'm pretty sure your provider probably already told you, but definitely you want to check your blood sugars, because how can you manage them without knowing what they are. A lot of diabetics, they don't like to do the finger stick. I know. That little stick, the anticipation of sticking yourself is very hard. I know. I go through it all the time, even now after being diagnosed with diabetes and working through it. And now my A1C, I said it was as high as 13. Now it is in the 5.4, 5.7 range. Check your blood sugars. Make sure you check your blood sugars. You should have a glucometer. You should have test strips. You should have lancets if you're using that method, or you'll have a continuous glucose monitor, which is a CGM. Models are Dexcom, Freestyle Libre, things like that, okay? They do have some other over-the-counter CGMs, so if your insurance does not cover the Dexcom or the Freestyle Libre, check into over-the-counter or online options where you can get a continuous glucose monitor if you're into that. If you don't want to have to stick yourself every day, you can have this little monitor on you where it will read your blood sugar levels all the time. So definitely check into that. But make sure you know what your blood sugars are, because you're going to be on medications. You're going to have to think about the foods that you intake. You're going to have to know what is causing your blood sugars to spike, and you're going to need to know if your blood sugars are getting too low because now you're on medications. Now let's think about foods. So as you're managing your blood sugar, as you're monitoring your blood sugars, you're going to start noticing what foods make your blood sugars rise, or what food you intake and your blood sugar stabilizes. You're going to start understanding what food intake, what you should intake to help your blood sugars. We know that carbs cause your blood sugars to rise. So you're going to want to stay away from a lot of rice, pasta, breads. You don't want to overdo it in that area. Also sweets. A lot of times we want that sugary thing after a meal, or a lot of times our drinks. I've seen where some people have just cut out sodas. Some people have just cut out sweet tea. Some people have just cut out sugary drinks that have a lot of added sugar in it, and their blood sugars went down. So think about that. Think about what I would say is maybe just do a overview of what you eat in a day or in a week. Look at that, and then do some tweaks to that to lessen the amount of carbs, the amount of sugar that you're intaking. But then on another note, you do want to increase your lean protein. You want to make sure you're getting in enough protein for your body, because the protein helps to stabilize your blood sugar. So you want to get those lean proteins in. You want to make sure you have a good overall nutritional plate without cutting out one particular thing or one particular food group all the way. Okay? Because we have to know that we're doing this for a lifetime, right? We're incorporating different habits that we can do for the rest of our life. So just make sure you're looking at that. Just definitely talk with a dietitian, talk with a nutritionist if you need to. And like I said before, research what will be best for you. Exercise. So you don't have to do anything strenuous. You don't have to run a marathon or anything like that right off the bat. But just start incorporating some light exercise into your daily routine. If you have not been exercising at all and you live a sedentary life, go ahead and maybe walk for 15 minutes a day. Then, as you are okay with that, increase it to 30 minutes a day. Then, after you're okay with that, maybe incorporate some other type of exercise. But walking is a good way to start. At least you're moving, right? You're moving. So the gold star is at least 30 minutes of moderate exercise every day. But like I say, start out where you can and then work your way up. Okay? Now, if your A1C is really, really high, it is way above the cutoff to say you're diabetic. So if it's way above 6.5, if it's, like I said, I started out at one point being at 13. And that was after gestational diabetes. That was after I had my daughter. That was, I would say years after I had my daughter, that my A1C was 13. So I can't blame it on the pregnancy. I can't blame it on that. It was my lifestyle. But you're going to be put on medication. Definitely take some time to study, learn, read about those medications. Why are you taking those medications? How does that medication affect your blood sugar? Because some medications, they have you to urinate the excess blood sugar out. Some medications, they cause you to produce more insulin. Some medications, they help with your cardiovascular system as well as your blood sugar levels. So understand why you're taking that medication. Okay, why did your doctor, what other comorbidities do you have that your doctor prescribed this particular medication over another medication to help with that? Because some medications are better for your kidneys. If you have chronic kidney disease, so like I said, some medications help with your cardiovascular system if you have heart conditions, and some medications, they strictly help you to excrete excess blood sugar. So why was that medication prescribed? So you ask questions, ask your doctor questions. You are entitled to do that. Ask them questions, ask the pharmacist questions, know why you're taking that medication. Then also learn about the side effects of those medications. Because like I said, some medications cause you to urinate more. So you're going to need to know that you have to have good perineal care in order to avoid yeast infections. Okay? You also want to know if a certain medication decreases your blood sugar rapidly. Insulin, some rapid acting insulins, they decrease your blood sugars rapidly. So you want to know that so that you can monitor for a decrease in your blood sugar after a certain period of time after you take that medication, to make sure that you don't plummet, your blood sugar doesn't plummet too far down, and because that is a negative side effect. So understand your medications. When do you take your medication? Some medications, like insulins, you would have to take them multiple times a day. Or there's other insulins, long-acting insulins, where you would take them one time a day. Also, you have the GLP-1s, where you're taking them once a week. You have pills that you may be taking one time a day. Also, notice if your doctor says half of a tablet, or if they want you to take 2 tablets. Sometimes you're taking metformin, and they ask you to take, if it's a 500 milligram tablet, they want you to take 2 of those to equal 1,000. So make sure you have a clear understanding of your medication if you're newly diagnosed with diabetes. This will help you as you continue to manage your blood sugars. And then soon, because we do want to be to a point where we can manage our diabetes without a lot of medications. So maybe soon you'll be able to come and titrate down off those medications. So that goes into another point. Back to monitoring your blood sugars. So your doctor, they may want you to write down your blood sugars. So get a little journal, a little book. Sometimes the glucometers come with little booklets where you can write down your blood sugars daily or throughout the day. And make sure you take that back with you to your doctor's office. Or sometimes the glucometers, now they're so advanced where they will keep track of your blood sugars online through their system. And that can be directly sent over to your doctor's office. You'd have to kind of look through that glucometer and look through the specs and things like that to see if yours does that. But that can be transmitted directly to your doctor so that they can have that, and then they can make changes to your medications from there. So look into that as well. But the ultimate goal is to, with the medication, with your diet, with your exercise, is to bring your blood sugars down and then titrate off of different medications if you can, because it may be overwhelming at first. You may be on different medications. You may be on insulin, as well as you may be on a oral pill form, as well as you may be on a GLP-1. I've seen that with some people. They've been on multiple different medications at first to help bring that blood sugar down rapidly because their A1C was so high, bring it down rapidly, and then titrate off of different medications. Okay, so write down your blood sugars or have some type of system where your doctor can know what your blood sugars are so that she can make changes to your medications, to your plan of care. And as you're doing all that, I know this is a lot, but you do want to get other things checked. For instance, your eyes. Blood sugar can affect our blood vessels and cause diabetic retinopathy. And what that means is that over time, having too high of a blood sugar can cause damage to your retina, and the blood vessels around your retina, causing diabetic retinopathy. And that could change your vision. And unfortunately, if your blood sugars are not managed well, that could even lead to blindness. So we do not want that for ourselves. So go ahead and get a diabetic eye exam done by your eye doctor. Have that information sent over to your provider if it's not the same as your primary care provider, and so they can have a baseline. But that diabetic eye exam will help to see where you're at right now, and then as you continue on, you'll do it again yearly, about every year. Yeah, you'll get your eyes examined, and then they can see if there's any changes from there to your retina and the blood vessels around. So definitely get a diabetic eye exam completed as soon as you can. Also, being that you are diagnosed with type 2 diabetes, you want to manage your cholesterol, you want to manage your blood pressure, because diabetes, high blood sugar affects your blood vessels as well, like I said, with the eyes, and just all your blood vessels in your body, which will in turn affect your cholesterol levels, can also affect your blood pressure. So you definitely want to make sure your blood pressure is checked, your cholesterol is checked, and if you need to do some things to tweak that, but by increasing your exercise and monitoring your diet, you will in turn help with those in those areas as well. But you may need to be placed on medications for blood pressure, for cholesterol. So just be aware of that as well. But all in all, I want you to know that being diagnosed with diabetes can be scary. I understand that, but we can manage it. You can get your blood sugar levels down. But I do want to stress and say it does come with you having a changed mindset. You have to want this for yourself. You have to want to manage your health. You have to want to get your health to a place where it should be. You have to have the mindset to do what's best for you, to put you first. A lot of times we look at others and we help others, but we're losing our own selves. So you have to want to help yourself. Okay, you have to want to put in the work. Yeah, it's going to be some work. You have to have a mindset to put in some change, because you are going to have to change some things in your lifestyle in order to manage your blood sugars. Hopefully this was a good overall view of being recently diagnosed with diabetes and where you should go from there. I'll try to continue to do a few more videos throughout this month, November, in order to help you as you're managing type 2 diabetes, and know that this is not something that you can't control, that you can't change. You can, just with some lifestyle changes. You can do this. You can manage your blood sugars. I am on the medication Mounjaro right now for type 2 diabetes. It is helping my blood sugar to be at this range where it's at, and I am stable at this range. Again, lifestyle changes had to come in play. But if you are diabetic as well and have some tips for anyone else out there, definitely put it in the comments below so we can help each other out. We can bounce ideas off of each other. Like I said, I'll continue to do a few more videos this month to help with managing type 2 diabetes and understanding it. I will also do a 2-year anniversary update on being on Mounjaro and where I'm at with that. So definitely check out those videos when they come. But as always, guys, I thank you for your love, for your support. Until the next video, I love you guys and God bless.